Another important update from IRCC today. Yes, we had our first targeted express entry draw today. My name is Gautham Kolluri. I'm a regulated Canadian immigration consultant and founder director of CIP, Study Abroad and Immigration Experts. I previously worked in Conestoga College and Mohawk College as the International Students Recruitment Officer. So let's dive in. What happened today? Well, finally, we had our first targeted draw, and the Government of Canada, invited 500 healthcare workers to apply for their permanent residence. So today, Minister Sean Fraser was in Nova Scotia and he made this announcement and also informed that another 1,500 ITAs will be issued next week for the healthcare workers. So let's dive in and will explain details about the program, and we'll just watch the live announcement of Minister Sean Fraser here, just a couple of minutes, and then we can get into the program page.
Let me just get underway here by saying that we're going to bring more healthcare workers into this country. The reality is we know that health occupations have been suffering from severe labor shortages in recent years. You don't have to pore over the data that we can readily access with Health Canada or with provincial systems to understand. Talk to anybody in a community who's been dealing with delays in the healthcare system. Talk to the healthcare workers who are under severe stress. Talk to the people who are standing here who are now helping process thousands of applications for people who want to come and practice here in Nova Scotia. We are going to do something dramatically different in terms of how we're going to run the immigration system to address some of these needs. For those of you who aren't familiar with how the Federal Express Entry System operates, which is our flagship immigration program to attract workers for economic reasons to Canada, historically it has assigned people a score based on a range of factors, whether it's your age, your level of education, your work experience, and a number of other factors that will assign you a score at the end of your application process. The system historically has taken the highest scoring people regardless of which sector that they work in. I was joined about a month ago on Parliament Hill with my colleague Jean-Yves Duclos to announce a change to that process, that we would be targeting 5 key sectors that were suffering from severe labor shortages. Those sectors included health, the STEM professions, agriculture, transportation, and the skilled trades. But the first sector that's going to benefit from this new process is healthcare. And today we are going to be launching the first round of invitations to apply through this category-based model. Today we're going to be issuing 500 invitations across Canada to apply, and within about a week there will be 1,500 more. The reality is that this new...
So this is basically what Minister Fraser has mentioned. So basically, right, so as per the update here, so today express entry draw, 500 invitations were issued. The CRS code was 476 and the occupation was healthcare occupations. So previously, what was the process in Canada? So previously, the Government of Canada used to invite people based on the highest score, but not an occupation. So the Government of Canada identified 5 occupations, and they have made so the Government of Canada identified 5 occupations: healthcare occupations, science, technology, engineering, trade occupations, transport occupations, agriculture, and agri-food occupations. So previously, anybody who had the highest code, irrespective of the occupations, were issued ITA. So what was the criteria? If a person was overseas, then age 29, they would get the maximum points, advisable to have at least masters, and then education, masters advisable, 3 years of work experience. IELTS was the most important criteria, like English language proficiency. So people who got 8 or higher, irrespective of what they were able to get their invitations, and additional points were for siblings. If you have brother and sister in Canada, you could get 15 points. Right, siblings if you are relatives, and if you had French language, you could get additional points. You could also get additional points if you have a provincial nomination. Tough requires support from an employer, except SIMP for some program, some categories. But that is basically what was happening. So today, if we're looking at the healthcare occupations. So these are the occupations. So 34 occupations. So audiologists and speech language therapists, chiropractors, dentists, dietitians, nutritionists, education counselors, general practitioners, family physicians, instructors with personal disabilities, kinesiologists, licensed practical nurses, massage therapists, right? Medical laboratory assistants, medical laboratory technologists, medical radiation technologists, medical sonographers, nurse practitioners, nurse aid, nurse coordinators, occupational therapists, optometrists, other assisting occupations in health and support services, and occupation, paramedical, pharmacy technician, physiotherapist, psychologist, registered nurses, and even surgeons, specialists in clinical laboratory medicine, veterinarians as well. So, interesting professions. So these are the people who were invited. So going forward, IRCC has this targeted draws, and based on this targeted draws, they will be inviting. So the focus is not just to bring in people here, but to satisfy the economic needs of Canada based on the unemployment or the high demand occupations, and these 5 were identified. So what is happening in India, guys? If you are planning to immigrate to Canada, please make sure that you first calculate your CRS code. So I will post a link how to calculate the CRS code. There's a previous video I did. And what is happening in India? There are so many scam agencies. They don't educate people, right, guys? So basically they will advise you, oh, Canada is inviting people. There are 100 plus different immigration programs, PNP programs. Please pay 50,000 rupees, 1 lakh rupees, and basically you will start, and they will not tell you basically that, right, age, you might be 35, but you might go up and signing up. You very unlikely that you will receive the points unless you have PNP or in the shortage of patients, targeted draws. Maybe you'll be lucky if you have ICRS score, and if you do not have masters, you might not have the sufficient points. And many people fail with the English proficiency. So and these agencies out there, they are not regulated Canadian immigration consultants. They don't advise the entire process, and they are not actually authorized. And what they do is basically scam people. They come up with all the false promises, make you pay the money, and they create a profile in Express Entry, even though they are not authorized. Many of those, except RCICs and immigration lawyers, only can provide these services. So they create your profile. Your profile is there, and you are hoping to get ITA to apply for your permanent residence. And after a few months, when you start digging in, what is happening? Why I'm not going to Canada? Where is my invitation for PR? Then you will understand basically that the criteria was not clearly explained, and you were scammed in signing up with these agencies. So guys, be careful. First thing, before you embark on your journey immigration, please don't pay. The minimum what you could do is understand the point-based system, how it works, the Express Entry, check your CRS code, and feel free to reach out to me. I'm in Zoom every day. We provide free consultation. I probably only immigration consultant in Canada who provide free consultation every day from 9 to 12. So feel free to join it. I'll share the Zoom link and also a WhatsApp group link and Office India offices links in the YouTube description. So this is Gautham Kolluri from CIP Study Abroad and Immigration. I'm a regulated Canadian immigration consultant. Please do subscribe to our channels and share your videos with your relatives, friends, educate them, and don't be scammed with all the fake consultants out there. So Canada has a very transparent and easy process. You can go to the website, check it, and almost you could do it. If you are capable of doing 8 IELTS, you also could do it. But again, it's just a lot of time and effort. So once you know that you're qualified, you're getting the points, then go ahead and reach out to me or other immigration consultants. So cheers, good luck, and see you in the next video.